Good evening, everyone, and welcome to the Prana celebration for 2021. Gearing toward the International Yoga Day, I'm Dr. Smita Prabhakar, your host for the event. Welcome to this amazing journey, helping you to shift toward a holistic yogic lifestyle. Yoga is the journey of the self through the self to the self. Prana, a blissful world. Prana is a 15K member platform dedicated to yoga, where yoga gurus, fitness experts, and enthusiasts from various parts of the world come together. Prana aims to carry forward the virtues of yoga to the masses. Prana encourages everyone to have a healthy lifestyle. Yoga is the finest way to connect people around the world. Through prana, we aim to promote the awareness of health and well being. In the present norm of social distancing, our aim is to bring yoga to the comfort of your own homes. Today's topic is the role of yoga in depression and COVID 19 management. Our guru is going to take us through various ways to identify psychological distress in people and the ways to manage it. An extremely important topic during these times. So hold on to these golden nuggets which are coming your way. And I would be really, really grateful that everyone needs to be here because this is something which is going to touch your lives forever. And let's take care of our lives and boost our immunity, and let's wait for the guru to share his insights. Before we commence this main event, let's start this evening with a prayer by Swarna Jairaj.
ॐ सङ्गच्छत्वं संवदत्वं सम्भो मनांसि जानताम् देवाभागं यदा पूर्वे सञ्जानानामुपासते. May you move in harmony, speak in one voice. Let your minds be in agreement, just as the ancient gods shared their portion of sacrifice. Namaste.
Thank you, Swarna. That was a beautiful rendition. Now, I'd like to introduce our special guest for the evening, Dr. Lijo Francis. Dr. Lijo has completed his PhD in chemical sciences and technology from the University of Genoa, Italy in 2010. He also secured two bachelor's degrees and two master's degrees. After pursuing his PhD, Dr. Lijo pursued his postdoctoral research at the National University of Singapore and at the King Abdullah University of Science and Technology in Saudi Arabia. He continued his career as a scientist at Qatar Environment and Energy Research Institute in Doha. Dr. Lijo Francis has received several renowned awards, including Young Scientist Award from the Leeds University, UK, in collaboration with Calicut University, India, in 2009, Best Research Paper Award from the European Desalination Society, EDS 2014, Cyprus, Young Academics Award from the European Membrane Society, EMS 2015, Italy, and a couple of Seed Fund Awards for his outstanding research and contribution to the membrane science and the renewable energy driven water reclamation processes. Dr. Lijo Francis is the author of 7 US European patent applications and more than 80 international conference, journal, and research papers. That was an incredible array of accolades. Now, I would like to invite Dr. Lijo Francis to address the viewers. Dr. Lijo.
Namaskar. Thank you, Dr. Smita Prabhakar, for your kind introduction. Respected guests and my dear friends, a very good evening to all. First of all, I would like to thank from my heart for inviting me to this auspicious occasion of 10th day celebration of International Yoga Day 2021. As all of you know, in 2015, United Nations declared June 21st of every year as the International Yoga Day. Yoga is an amazing physical, mental, and spiritual practice which helps in making a healthy body and a healthy mind. It's a beautiful exercising practice that links the soul to nature and keeps fit and active. Especially in the current pandemic scenario, the relevance of yoga, which brings a calm and healthy life environment, is invaluable. I'm not going to talk a lot about the general advantages or benefits of yoga. Instead, I would like to share some of my life experiences in which the benefits or qualities that I gained through yoga practice. I started my yoga practice for the first time in 1996. Yes, exactly 25 years ago. At that time, I was studying first year bachelor's degree of chemistry at St. Thomas College, Thrissur, University of Calicut in India. In those days, Yogasanas and Surya Namaskar was one of the all India inter-university competition events. Our physical education department decided to form a yoga team in order to compete in the university level championship. Sri Shashikumar Nallai was my first beloved yoga guru. Most of you might be knowing him. With commitment and dedicated practice, we won the University Yoga Championship for the consecutive 5 years while I was studying at the University of Calicut for my bachelor's degree courses and master's degree course. When I started and continued to do my yoga practice, surprisingly, I was assimilating the beautiful human values and qualities in my life, such as discipline, punctuality, etc. Apart from those qualities, I really experienced the power of concentration through yoga meditation and memorizing power, the subjects that I learn or I read as a student point of view. Basically, I come from a below average family. I born and brought up in a small village named Chevu in Thrissur district of Kerala state in India. I had to work really very hard after my college time to meet my study expenses and to take care of my family as well. I was also a very slow learning student before I joined the college or before I start my yoga practice. Hard work and dedicated yoga practice really changed my life. I could win not only the University Yoga Championship, but I could successfully complete the university degrees with high distinction and first class grades. The journey from a slow learning student to a frontline successful student is really, really amazing. As a result, I could climb towards the dream career as a scientist that I was dreamt from my childhood days. As part of my research career, as Dr. Smita Prabhakar introduced in the introduction, so far I have published 8 United States patents, European and international patent applications, and nearly 80 international conference and journal articles. I have presented my research findings in many countries across the world, including United States of America, United Kingdom, Canada, Australia, many countries in Europe, Middle East, Africa, Singapore, China, and so and so. I'm very glad that a lot of renowned scientists and professors are discussing my research findings on environmental friendly seawater desalination technologies and membrane engineering processes. So I thank yoga for changing my life. The World Health Organization, WHO, also encouraged people to practice yoga daily. So they also said the more active the people are, the healthier the world will be. Especially in the current pandemic scenario, it's very important to improve the immunity rates. So I would like to congratulate the team Prana for their enormous efforts and organizing this great event and inspiring people. With that, for the time being, I'm concluding my talk. Love and peace be with you, my friends. Thank you. Om Shanti.
Thank you, Dr. Lijo, for your kind words. I'm just in awe of your humility in spite of your massive achievements. Truly, we are greatly honored to have you here with us on this occasion, in spite of your personal commitment today. That truly shows your sincerity and commitment towards yoga. So grateful. Now, I'd like to take this opportunity to let the viewers know that around 8:15 we will be opening the segment for Q&A. If any one of you out have a question, please do put the questions into the FB Live chat box or Instagram chat box, and we will take as many questions as possible live. Now, the moment comes. Now, I'd like to introduce our guest, our guru for the day, Dr. Raghavendra Rao, M. BNYS PhD Director, Central Council of Research in Yoga and Naturopathy, Ministry of Ayush, Government of India. Dr. Raghavendra Rao completed his bachelor's degree in naturopathy and yogic sciences with the second rank from the Mangalore University in 1998. He joined S. Vyasa as a research fellow in 1998 and went on to become an assistant professor. He has completed several research projects in rheumatoid arthritis, pre-diabetes, diabetes, CVD risk prevention using both yoga and naturopathy interventions at Swami Vivekananda Yoga University, MS Ramaya Hospital, HCG Bangalore Institute of Oncology. He was a collaborator and Osho PIC RCINH Fellow at UCSF School of Medicine, San Francisco from 2004 to 2006. He completed Indo-US study on yoga and pre-diabetes, yoga and HIV with UCSF School of Medicine, San Francisco. He completed his PhD in 2007 and joined Healthcare Global Enterprises Limited, Southeast Asia's largest network of oncology hospitals, as a senior scientist and a head of CAMP program. He has 89 international research publications and one international book chapter. He is a member of the Ayush Research Portal, Government of India. He has won several awards, such as Sushila Thakur Prakriti Mender Prize in 2001 by Apicon, Manonmani Rudraya Award from S. Vyasa for Best Thesis, and ASCO Conquer Cancer Foundation Merit Award in 2012 by American Society of Clinical Oncology. He has conducted workshops in Melbourne and Malaysia in UICC Congress. He has set up a department of CAMP at Healthcare Global Enterprises, which is accredited by European Society for Integrative Oncology. He has experience in conducting global clinical trials and was heading the Triesta CRO, Triesta Biorepository, HCG Cancer Registry and Clinical Repository and Clinical Audit and EHR. He has also undergone NABH assessor training by QCI. He has recently joined the post of Director, Central Council for Research in Yoga and Naturopathy, Ministry of Ayush, Government of India. Oh my God, that was quite a mouthful. I mean, I can't imagine in a lifetime so much of achievement. We at Prana, sir, take great pride in welcoming you and to have you with us in this occasion. Please help me in welcoming Dr. Raghavendra Rao. Dr. Raghavendra. Namaste.
Namaste, madam, and thank you so much, Dr. Smita, for your lucid introduction of myself. I won't take much time, and time is essential. And I'm also thankful to Dr. Lijo for being with us here in spite of certain problems and calamities in his house. And I'm certainly overawed by his experience about yoga and how yoga has really transformed his life. That's what yoga is going to really do. And that has really set the stage for my talk here. Share my experience and my research on various aspects of yoga, on patients such as cancer, on depression patients, and as well as on COVID patients of late. So let me just begin, because these are testing times, COVID times. People have a lot of anxiety, there's a lot of depression, and because there's a lot of uncertainty about the trajectory of the disease. How it's going to behave in some, we really don't know. And that is really a ticking time bomb for most of us, because it prevents us from doing our normal chores. It lets us to not let go of our God any moment in time, because sometimes you have to be responsible for your actions as well. And these things are testing times indeed, and it has caused a lot of anxiety among the communities. So let us also look at how yoga has played a very, very important role in these testing times. So let me begin my presentation by sharing my slides. Also want to thank the entire team of Prana, as well as my colleague Dr. Pratibha also, who is here, for having invited me here to this function on this occasion of IDY. We have been doing back and forth a lot of events right from morning today, and this is, I think, probably my 6th event of the day. So let me just begin by sharing my slide. Yeah. So my topic for today was to look at depression and the role of yoga for COVID. This is very, very important because both are two different topics, but they do overlap each other. So they wanted me to talk on depression, but I also expressed my view on talking something about COVID, hence the fusion of two different subjects. But I'll try to make justice for both of them. We know very well what depression is all about. It is about being low on mood, having no interest or no motivation to do any activity. And it's a common disorder affecting almost 17% of the population in one's lifetime. It's a very, very important aspect. 1 in 8 women are affected, and 1 in 12 of men are affected. Women are more so affected than men because they're supposed to be more emotional, and they're supposed to be affected by stress. Their stress resilience is lesser compared to that of men, and also because of they have their own reproductive hormones, which also play a very, very important role in these affective disorders. So we know that why depression is important here is because it just cannot, because this is a chronic disorder. It is episodic. It is having these kind of symptoms, being low on mood for more than 2 weeks at a stretch, and sometimes this becomes progressive over time and leads to a severe form of disorder called dysthymia, or that is persistent depressive disorder. And this is a very, very important aspect because this can reduce your work efficiency, it can reduce your work productivity, it can make your life miserable, and it can also lead to several other disorders like heart disease, diabetes, cancer, and whatnot. And depression also can lead to suicide, and it is responsible for second leading cause of death in 15 to 29-year-olds in the world today. Okay. What are types of depression? What are symptoms of depression? When you say somebody is depressive, when you have 5 of these 9 symptoms, you say you are depressive. And first 2 are very, very mandatory and they are very important. Having a depressed mood, being irritable most of the day or nearly every day, feel sad, feeling of sadness and grief, okay, and appearing to be tearful, like you say something about the person, he feels like crying or feels like having grief. Okay, decreased interest or lack of motivation to do any activities. Okay? And these 2 are very important salient features of depression. Apart from this, change in weight gain, it may be weight gain or weight loss, change in appetite, it may be overeating, eating disorders, or it may be undereating, not eating at all. It can be insomnia or hypersomnia. It can be psychomotor agitation, irritability. You can't stay in one place, you become very irritable, very restless, fatigue and loss of energy, guilt, feeling of guilt and feeling of worthlessness, lack of concentration, ability to move around tasks, suicidal tendencies. So if you have any of the 5 of these 9 symptoms, we classify them as having some amount of depressive disorder. And when this is sustained over more than 2 weeks, that is when we call it as a clinical depression. Okay, you may be having mood swings, but if these are persistent over time, that's when you call them as. So if you look at psychiatric disorders prevalence with age, I won't go into all of them, but you can see the first top left corner, you can see both anxiety and depression, which increases along with age. As you grow older, your propensity to get anxious, become anxious, or propensity to get depression increases as you grow older. So there are different types of depression based on its severity. One is mild, other one is a moderate, and a severe form of depression. A severe form of depression is also called as dysthymia or persistent depressive disorder, and it can last for almost 2 years or 3 years at a stretch. Patient needs to be on medication most of the time, and these medications also reduce your concentration, reduce your ability to work, and reduce your executive functions as well. Okay, they cloud your thinking. This is what medications also do if you are only bent on medications. And they are depression with mania There's depression without mania as well. Mania in the sense becoming anxious, becoming restless, becoming irritable or agitated on one time, and becoming very sad, aloof, disinterested on the other time. This is a bipolar kind of a disorder. Okay, and you also have winter depression. It's called seasonal affective disorder, usually seen in the northern part of the globe, where you have long winters, you have long nights, and especially in Antarctica and Arctic, you have 6 months of night time, and you don't even have sunshine during the 6 months. And those are the kind of environments and which can affect your circadian rhythm of hormones and also cause depression as well. And depression can also exist with cancer, HIV, or any other debilitating disease like any trauma, loss of a limb, or bereavement of the near and dear ones, or whatever it is. So if you look at these are all the symptoms, I don't even want to go deeper into the symptoms: feeling of hopelessness, feeling worthless, aches and pains, fatigue, loss of sleep, anger, irritability, and so on. And if you see what happens here in a depression here, it's important to understand that depression is just not something to do with the neurotransmitter levels, a decrease in serotonin levels, decrease in noradrenaline levels or anything, but it's also to do with certain changes which also happen in the brain. So depression doesn't occur overnight. It occurs over a period of time. Repetitive thinking about the same problem again and again, rumination, which we call it as, just thinking about the same thing. Somebody said something about you. You keep on thinking about the same problem right from day morning to night without even going and making an effort to ask the person whether you said this or not. And if you said this, what was the context in which you said this? Okay, we try to become prejudiced and make our own judgments and start thinking about the problem again and again. So this is a problem here. And as you keep doing this, certain areas of the brain get hyperactive. Like you have the fear center called the amygdala here. It becomes hyperactive. Next to amygdala is the hippocampus, which is important for memory. This becomes underactive. You have loss of memory, loss of working memory, etc. And your limbic system becomes overactive. So increase in cerebrospinal fluid will be more. There are more of inflammatory kind of pathology here inside your brain. Okay, a lot of things, and your pituitary gland gets bigger in size because it has to release a hormone called stress hormone called ACTH. And this adrenal cortex also becomes thicker in size because it releases a hormone called cortisol to cope with this particular situation. So this is what happens when you have this kind of changes in your brain. You also have a chronic inflammation and stress, which activates the nerve cells inside your brain, produces cytokines. They interfere with the tryptophan serotonin metabolism, cause production of certain acidic molecules called kynuric acid and quinolinic acid, which can damage the nerve cells. Okay, there is damage of the nerve cells over long run. There is destruction of the tissues inside your brain. This can lead to depressive disorders. It can also lead to, as you grow old, to dementia as well, or Alzheimer's disease as well. Okay, so what's the treatment for depression? Mainly antidepressants. Take long-term antidepressants. Or if it doesn't go with antidepressants, you get electroconvulsive therapy. You give shocks to the brain. You're waking up your brain. Come on, get up. You don't have any activity. Come on, get up. That's what you're trying to do. And if those also fail, you also do other things along with this, or cognitive behavioral therapy, trying to counsel the patient, problem-solving therapies, interpersonal psychotherapies. And along with this, off late, what has been added on is aerobic exercise, yoga, and meditation. So let us now look at how does exercise play a role in depression. 30 minutes of exercise per day can reduce depression by 50%. It's a very important landmark study which has been done, published in NEJM as well. It was published in the year 2001. I can look at it. So they say if you have a depression or if you want to prevent depression, just do moderate physical activity or exercise every day for 30 minutes. That's what it says. And either you can just take pills or you can do this. That's what is the cartoon all about. And if you can see this, there's a study which has been done there, which has been published in a very reputed journal, where they showed that if you can expend 17.5 kilocalories per kg per week of energy expenditure by doing moderate physical activity. It can be walking, running, jogging, aerobic exercises. It can be more yoga, or it can be any sort of exercise you do. But if you're able to expend at least 17.5 kilocalories per kg per week, okay, roughly to say if you're 80 kg, it's roughly to say around 2,000 or 3,000 kilocalories per week. If you're able to do that, you can reduce your symptoms of depression very drastically. It's like a mood elevator. Exercise produces what is called endorphins. Okay, and these endorphins are the ones which help in giving you a pleasant mood, and it is a mood elevator basically, and it helps in preventing the destruction or neuronal damage in the nerve tissues. It prevents reduction of it reduces the inflammation in your nerve tissues, and it helps in taking care of depression in the long run. This is a very important strategy, a lifestyle intervention, and a lot of studies have shown with respect to weight training, aerobics, jogging, whatever it is, that is known to decrease cortisol levels, decrease inflammatory cytokines, and improve certain factors which help in the growth and development of the brain, or brain-derived neurotropic factor, endorphins, etc. These are produced within your own body. Okay, all you have to do is to find ways to produce them by your muscles and other tissues inside your body. So, how yoga can be used as exercise? We know what exercise can do now. How yoga can have an add-on effect on the respect to its exercise. So, yoga is not just exercise, but it's a mindful exercise, we say, because depression is a disease of the mind. It's a disease of your thinking, a disease of your outlook to life. So, only way you can correct this is by changing your outlook to life, learning to discern your mind. Okay, and there's a lot of studies have been done on yoga and depression. For 219 studies have been published till date, starting from 1991 onwards. And every day, new trials are being done in various parts of the globe. And if you see what type of yoga has been used in depression, you have Sudarshan Kriya Yoga, you have Iyengar Yoga, you have the integrated yoga program, it's a mixture of asanas, pranayama, meditation. You have restorative yoga, you have the Hatha Yoga, you have mindfulness based stress reduction called MBSR. So these are all some of the yoga techniques which have been used to cope and help in fighting depression. And if you see, the majority of them is MBSR followed by integrated yoga program, and then followed by Hatha yoga program, and then Iyengar yoga, and so on and so forth. So if you see three attributes of mind, according to yoga philosophy, mind has three different gunas. Tamas guna, the sattva guna, and the rajas guna. What is tamas means? It is an inert, dull mind, inertia. You get up in the morning and you just stop the alarm and say, I don't want to get up, I want to sleep for some more time. That's the tamasic guna inside you, preventing you from getting up, preventing you from doing any normal chores, or preventing you to be lazy and aloof at your own self. And that is the deluded mind, we call it as. And this is called tamasic guna. And then you have a sattva guna, which is a calm, non-judgmental mind, which allows you to do all the activity with a lot of internal awareness without being affected by it. Then you have the rajas guna, the hyperactive mind, which drives you, which gives you the motivation and to do certain activities and certain work. It is a restless kind of mind, an impulsive kind of mind, and it can lead to anxiety, it can lead to anger, it can lead to frustration as well. Okay, and if you don't get anything to do, it leads to boredom as well. Okay, these people tend to take the small activities, and they get bored with the activities in a very short span of time, and they're not able to do one activity over a longer period of time at all. So this is called rajasic guna. Okay, so these the rajasic and tamas are very important gunas which are interlinked and overlapping each other, and they're cyclic. Okay, and these need to be balanced. When any one is gone to the extreme, then it leads to a problem. If it is a rajas guna more extreme, it leads to anxiety and mania. If tamasic guna is more extreme, it leads to depression and catatonia. Okay, or anhedonia. Sorry. So these are the aspects these are the attributes of mind. And what yoga does is use the practices to break the tamas by using rajasic practices like stimulatory practices like Surya Namaskar. Like if you have a depression, do hyperventilation breathing, do Surya Namaskar, do a lot of asanas. So you awaken the dull mind. Once it's awakened, then you slow it down, calm it down, and relax that mind by doing pranayama, by doing relaxation techniques. Okay, you take a depression patient, you start doing yoga nidra for a depression patient. The patient cannot really pays attention to yoga nidra. He cannot get the relaxation because his mind is dull, it's inert, it's deluded. So what you need to really do is wake up this particular mind, and that you do it by these practices, stimulatory practices. Once woken up, you then get down to a state of calmness, a sattvic state of mind by practice of pranayama and meditation. Okay? So we know all these personality types which I told you, tamasic, rajasic, and sattvic. A depressive personality person is actually a tamasic guna kind of a person. It's because of this tamasic guna, you have this mental inertia which cause panic blocks, which cause problems in the body as well. So there are psychosomatic diseases which also associated with depression. Like you have pain, you may have fatigue, you may have loss of sleep, okay, loss of appetite, you have acidity. All these things are also because of the changes which happen in the physical body because of the psychological realm. Okay, so there is a study which was done very long time back in year 2000 in NIMHANS in Bangalore. They used Sudarshan Kriya Yoga compared to electroconvulsive therapy compared to imipramine in subjects with major depressive disorders. Okay, 3 weeks of intervention was given. What they found out was at 3 weeks, 93% of the patients with electroconvulsive therapy were not having relapse, whereas 76% of those with yoga were not having relapse, whereas only 63% of those with imipramine were not having relapse. In the sense, yoga and electroconvulsive therapy was much better than imipramine. So yoga is significantly better than antidepressant drug called imipramine at 3 weeks of intervention. This is a very landmark study, and after this, several other studies have been done to look at the physiological mechanisms by which yoga helps in patients with depression, and they've shown that there is a moderate evidence for short-term effects of yoga in depression patients. And we also seen these effects of yoga in patients with cancer who have anxiety and depression. These are our studies, which you can see on top. They are put in the meta-analysis on cancer patients. They were shown that yoga helps in reducing depression in both anxiety in both cancer patients, in breast cancer patients. And if you look at how does it do, we also done a study. We looked at cortisol levels. So early morning, you have Brahma Muhurta, we say, right? You know, about 4 o'clock to 6 o'clock, we ask people to read, to study. But because of the reason that your cortisol levels are very high, your mental faculties are very, very alert. Okay. And that is when if you do a lot of reading and studying, your long-term memory is going to be better. Okay, because the nerve connections are better at that particular point of time. So what they are seeing in depression patients is their cortisol levels are quite high in the morning, but they're also quite high throughout the night. Because they're high throughout the night, they can't sleep, they become restless. Okay, and because they're restless, cortisol levels are doesn't really do the job it is supposed to do normally, and that is a big problem here. And that's what we have seen here in yoga group. By using yoga intervention, we are able to reduce the cortisol levels in cancer patients who had depression before and after radiotherapy. And this is a significant, and it was published in a very reputed journal called Integrative Cancer Therapies. Now I come to COVID symptoms. You all know about COVID now. I think it's interesting now, because you know that when you have COVID, you have fever, you have loss of appetite, you have fatigue, you have anxiety, you have depression, you have muscle pains, you have loss of taste. And of recently, in the second wave, we also seen diarrhea and GI symptoms as well. So it is a systemic disease. It's not just confined to the lungs as of now, as people like to believe it. So it can cause coagulation disorders. It can lead to strokes. It can lead to heart attacks. It can lead to cardiomyopathies, okay, and whatnot. It can even lead to autoimmune diseases as well. So what we saw was to look at what people harbor, what sort of myths people are harboring regarding COVID-19. So we wanted to look at myths people have regarding COVID and what are these myths. So we looked at WHO website. In the WHO website in April 2020, 15 myths which people had regarding or concerning COVID. You know, like for example, eating garlic prevents corona infection. Exposure to temperature greater than 25 degrees prevents corona infection. This is what they should do is when you get vegetables from the grocery shop, is to wash it in salt water, dry it in the sun and soak it in the sun for about 2 hours and then take it inside. Same thing was to happen with even newspaper also. You know, I used to see one of my neighbors putting water on the newspaper and then soaking it in the, putting it on the balcony. Okay. And these are some of the silly things which people are trying to do to prevent COVID. And they really do not have much knowledge about it. Saline water rinsing of the nose with saline also was supposed to prevent COVID or prevent coronavirus. So vaccines against pneumonia was supposed to prevent against coronavirus. Okay. And hand dryers was supposed to kill coronavirus. Putting alcohol across your body is also going to kill coronavirus. Drinking alcohol, okay. This is one important thing which you're seeing during the first 2 lockdowns in India, where when these shops started opening up, the liquor shops started opening up in Delhi, you had a horde of people in long queues stretching up to 1 to 2 kilometers. Okay, and the belief was that many of them were believing that since ethanol is going to kill coronavirus, so you may as well be good with drinking alcohol as well. Okay, this was their logic, and this was leading to all sort of myths in the community. And what we saw was myths was widely prevalent, and we did a big survey about 4,002 patients across India. And when we did this survey, what we saw was myths are almost prevalent in more than 93% of the population. Okay, everybody had some myth or other. They never got all these questions right, and they had some misconceptions about COVID. And these misconceptions only increased over time in the last 1 year. Okay, and we saw that what is the reason for this was also your internet. Most of them are confined to their home. Most of them are confined to the online media and online digital workspace, more so than ever before. And These were some of the terms which were having large amount of hits on the Google search engine. And we saw the number of articles being published when you started using the keyword search for Indian region. And we saw these keyword search, especially cure for COVID, cure for coronavirus, just increasing significantly. Simple example I can say you is a boosting immunity. We all talk about the word boosting immunity. It is good in one sense when you talk about it, such as when you say you want to take turmeric and or haldi milk and etc. It is known to have immunity, it can boost immunity. It makes some sense there. But here, please keep one thing in mind. Boosting immunity is actually a wrong term to be used in COVID because the maximum damage occurs because of the hyperactive immune response. So if you boost the immune response, you only end up in getting more damage to your tissues and organs inside your body. So the word boosting immunity is a misnomer. Okay, it's not the right word to be used in management of COVID. So this is one thing which was a big catcher for most of the patients. We started trending this word boosting immunity, and everything from paints, soaps, detergent, plywood, hamburgers, and everything and anything which was there on the FMCG market were all branded on boosting immunity. Okay, and this is what was the scenario today. And what we also saw was amount of myths which was seen months on months, the percent of myths correlated with the number of searches you saw on Google search engine as well. Okay, and this is very important. Now coming to yoga and how does yoga play a role in infections? There's a study done in 2018 where they used yoga intervention, exercise, meditation in Wisconsin University, especially in the North America, where it was the endemic season during the winter. People usually tend to have flu and influenza infections there. They gave one group exercise, one group meditation, other group didn't do anything. And they saw that exercise and meditation decreased the duration and severity of the flu episodes in this population. Okay, this was published in 2018. It's a very landmark study. We did a big study here in India, back here now. It's going on even today. The role of yoga in COVID in Rajiv Gandhi Super Specialty Hospital. It's a big COVID care hospital. 1,600 bed, 1,600 patients are admitted there. AIIMS Jhajjar National Cancer Institute at Haryana in Jhajjar, Lady Hardinge Medical College at Hospital in Delhi, All India Institute of Medical Sciences Delhi, and AIIMS Rishikesh. So these are the top national institutes in India, and we did this study along with these doctors there in the COVID care centers there in the wards. We started using yoga interventions to improve mucosal immunity using Neti Kriya or what is called Jal Neti or saline nasal irrigation, improve viral clearance by using pranayama, improve respiratory effort by using pranayama, and using asanas to improve tidal volume, lung volumes, and vital capacity. Okay, and to reduce inflammation and damage, also to improve relaxation, reduce the stress which is causing more inflammation in these patients. And we also started emphasizing on the kind of diet they should be taking and some of the home remedies which they can really do, some khadas they can do at home to take care of their immunity or take care of the respiratory symptoms. So this is a simple yoga model we used, a mixture of some asanas to improve lung capacity. Yogic breathing. Breathing is a very, very important aspect of COVID-19 management. You don't require to get oxygen concentrators from outside. If you are able to practice yoga, if you are able to breathe properly, if you are able to use your lung capacity to the maximum extent, practicing yogic breathing, okay, you can really store huge amount of volume of air inside your lungs. The lung capacity can really expand from 6 liters to up to even 15 liters. Okay, you don't require a concentrator next to you. So pranayama or yoga itself is a very good concentrator for you, oxygen concentrator for you. You don't need to hold oxygen during these times. If you can prevent COVID-19 by doing proper practice of pranayama before, that is going to be more than enough. You will not end up with any complications. Okay, so this is very, very important, and we started giving this to patients who are admitted to these COVID care hospitals with mild to moderate symptoms, didn't require oxygen therapy. Okay, and this is some of the techniques used. We want to see whether it can help in reducing the infection rates, improve sleep, reduce stress, reduce the flu symptoms in these patients other than them. So you can see here patient lying on the mattress. He had a sensor mat, sensor technology. You can measure the stress levels, measure the sleep levels, and measure how much relaxed they are after yoga program. And this is a sensor technology done by IIT Mumbai, which we validated in this particular study. And you can see here all the patients in the COVID wards doing yoga, or yoga instructor going there on the PPE kit and teaching all the patients yoga here in these wards. And this is a sensor technology we use. And this is how we used to monitor the patients. So this sensor was placed under the patient's mattress and inside the patient's bed. We could measure what is the time they went to sleep, what time they got up, what was the deep sleep, REM sleep, and what was their how many times they awoke during the sleep. So everything you could make out. And how much did the sleep help them? Did they recover from the stress after the good sleep? What is the recovery after sleep? That also we were able to measure for most of these patients. So these sensor DOSI was integrated to the patient's own mobile, and the patients could also look at their own sleep score every day, and they could also ask to practice yoga in their own wards, in their own beds, and they were able to see what was happening after doing yoga. So by doing yoga, you can probably see that after every after doing yoga, you could see that the respiratory rate it came down, the heart rate came down, stress levels came down, and how many movements also came down in these patients. So we're able to monitor the quality of practice in these patients. This is a dashboard of one particular patient you can see, where you can monitor the sleep, you can monitor the sleep score, you can monitor how much time they're awake, how many number of awakenings they had, how much deep sleep they had. It also tells you in the bottom how much amount of stress they had, and it helps us to quantify the stress response. We quantify them using what is called heart rate variability. Okay, so this we saw that the yoga group were able to relax much better. The sympathovagal response was there in the yoga group compared to controls, and we saw the relaxation response called SDNN or RMSSD, which we used for measuring, was significantly improved in the yoga group. The blue one, the pre and post after first day and day 0 and day 6, you can see the improvement in the graph in the blue one, and that is the yoga group, which showed significant improvement. And we also saw that only 4.2% in the yoga group required oxygen supplementation during their stay in the hospital, compared to 14.7% in the control group. This is also very, very significant. It prevented severe form of the disease, a severe form of COVID in 10% of this population. And this is all about yoga and COVID. And to understand that we all go through mood swings, but yoga helps you to keep oneself more peaceful, more cheerful in these testing times. Thank you so much. I'll be happy to take questions now.
Thank you so much, Dr. Raghavendra Rao. That was great, valuable information beyond what we could even ask for. Thank you once again for the scientific explanation and the research details of the main lifestyle diseases as well, and including the information on COVID. We really needed this information, especially now, we know now what we are doing, why we are doing, especially yoga and mindfulness. Beyond doubt, I'm sure that the viewers have immensely benefited from the session. Now we will take the questions while the Prana team is collating the questions. And before we get into the Q&A, I have a very important announcement. First, I would like to congratulate Prana once again for reaching 15K Facebook followers yesterday. The biggest proof that the Prana vibe is spreading and the message of the International Yoga Day, the yoga and mindfulness is reaching the masses. This is the result of the Prana core team working relentlessly, and I appreciate their effort in spreading the message of peace through yoga. Congratulations once again. And also remember to send your videos for the yoga challenge. The challenge started yesterday, and we will be closing the registration and accepting the videos on June 20th. The video will be chosen based on the main criteria and the number of likes. Please note that anyone at any level can participate in the challenge, whether you're an expert or a novice, it just doesn't matter. We want you to get started. So waste no time. You know the importance of yoga and mindfulness in our lives. So don't waste time and start posting your videos right away. Let this be your start. Now, let's get into the Q&A segment. I'm just taking the questions from the viewers. Before that, I would want to tell you, Dr. Raghavendra, depression has been a very, very close subject to me because I personally suffered from severe depression during my college times. And now my life mission is as well to help with the authorities to help people going through depression. That's been my life mission now. To help people with the suicidal tendencies and helping them with the anxiety and depression. I just want to ask one question. How do we know when someone is gearing towards a suicide, and how do we identify the stage of a depression patient, which is quite crucial in terms of identifying, and when someone has a symptom, how do we know that? Could you share some insights on that, please?
It's a very important question for us to understand this, because the only way you know that somebody is going with a severe form of depression is to observe the change in his behavior. And this has to be done by somebody who is very close to the particular person. And often 70 to 80% of the population, people who have these depressive symptoms, don't go to a doctor because they equate depression with a mental illness. They equate a psychiatrist to somebody to be a doctor for mental illness, and they don't want to be branded as somebody who's mentally ill. And that is the unfortunate thing which is there, stigma which is based in our society, which prevents people from taking recourse to any sort of help or any sort of treatment. And this is said and done. These are kind of people what you need to really watch out for in any workplace or any sort of social gathering. Are these are the kind of people who stay aloof, stay for themselves, who hardly interact, who hardly talk, who hardly voice their opinions. Okay, and if you can see them becoming more and more of aloof, if you can feel, if you can see that they're becoming more irritable, more agitated, they're not their usual self. These are some important indications that they are going for the worse. Okay, it's difficult to say when they'll go for a suicidal tendency because this is something which really comes out of the blue. So you will see suddenly one fine night somebody calls something, I'm committing suicide, I'm not going to be here, take care of my dog. Okay, period. This is what happened to one of my close friends. And this is a message he put up for all of us in the WhatsApp group at one fine then. And suddenly we came to know that something is wrong with him. We started calling him frantically. He was not taking the calls. And we had one of my other friend who was near to his place, had to rush to his place to get him there. And he was very thoughtful. He even called the ambulance, he called the police, and he was able to go and save him in time. And it was very good because he already cut his wrist, and his radial artery is already bleeding, and he was fainted. He had already fainted. So they had to knock open the doors and get him out of the place. So these are some things which really happen. And people who have this depression, who undergo this suicidal tendency, is very difficult to help them unless they want to be helped. So having some near and dear ones trying to recognize the problem is very important. And then trying to see that the help reaches the person is also very, very important. So this is a thing which is a problem which is plaguing the whole world today, because you can see the mortality rates are quite high, especially in 15 to 29-year-old age, in that age group, because these people are very impulsive. They don't have the kind of a maturity, understanding. They are stubborn. They don't listen to others. It requires a lot of sessions of counseling, changing their outlook towards life. It requires all these things. And what better way to do that than by doing yoga? Somebody who is completely agitated, irritable, is not ready to listen to your sermons, the only way you can do that is to first learn to make him calm down. Okay, make him do some deep breathing exercises, make him do some asanas, get him into a yoga class. Gradually start calming down, and once he's able to calm down, then he's able to see what his thought process is going on, what he's doing is wrong. He's able to identify those stressful situations. He's able to calm himself down. So unless that happens, it's difficult.
Great. Thank you so much for that valuable information, because that connects to people's life, and people do have the stigma saying that is it mental illness, and so they don't reach out, they hide it within themselves. I wish that the communities and groups which can help them say that there's no judgment here. Please reach out when you need help. So when more and more organizations like these, Prana, and many other organizations, and Ayush is doing a lot of work in that space, so that people know that there is help out there. And just one more question, how to stop medication when they know that you're reducing the depression, and what's the right time to stop medication? And the last question would be, in the COVID, you mentioned quite a lot of information, and there's so much of handful. What are the first three things what people could do right away to prevent themselves from COVID? So these two questions, please.
First question was to look at how to stop your medication and when to stop the medications. It is just best done by the psychiatrist or your doctor. Okay, so this is not some antidepressant medicines are something not which you can just stop overnight. It needs to be tapered gradually over time, and it also depends upon the amount of what sort of mood you're in basically. So best way of doing that is to look at self-depression scales. There are certain scales which are there which patients can use. Hamilton rating scale for depression, Lex depression inventory, Spielberger's state rate anxiety and depression inventory. Okay, those things, some of the self-report scales can be used, and you can mark yourself on those scales. Unfortunately, I don't see that many of them really use these things, but they use it in a clinical trial scenario. They use it in this to show that this particular drug works, I don't understand why these self-report scales can't be used by patients themselves. They can chart out every month and see what is the score on this particular scale. Okay, they can judge themselves, and we know the cutoff scores for those particular scales. Like for HRDS, if your cutoff score is below 7, that means you are okay. You don't need medications. Okay, you can wean yourself off medications if your HRDS scores is consecutively lower than 7 for next 3 weeks or 4 weeks. Okay, so that kind of thing, I think one should also try to put in practice. If HRDS is not done, at least a consultation with the psychiatrist is important to understand that. And you yourself, as a patient, you yourself know what your mood is today. Your interest, your rigor and interest in activities, your motivation in your work, okay, your enthusiasm for doing things. If these are coming back, you have your mojo back. It means to say that you are coming back, rebouncing back. That's the time when you do more and more of yoga. You do more and more of yoga so that you can start tapering down your medicines easily. So it has to be done in consultation with any doctor. Okay, and along with that, with a yoga therapist or a doctor again. So they both of them work together and try to taper your medicines and improve your activity and improve your mood as well. This about depression. And about COVID-19, if you want to really prevent COVID-19, is the best way of preventing, we say, is social distancing. In fact, in our study which we did on myths about COVID, we saw that only 16% of the people believed about social distancing is going to prevent COVID. Okay, and you still see the crowd in the markets. You see the crowd in the buses. You see the crowd in the trains. Nobody does really believe in social distancing. But you just, what is very, very important here, having masks, having social distancing is very important. Another one important thing I would like to tell you is breathe. Learn the art of breathing. Learn to improve your lung capacities. Okay, if you can do that, then if you do get the COVID, you will not get a severe form of COVID. Much I can assure you.
Thank you so much, Dr. Raghavendra. It's such a valuable topic, and you have given us more than what we can ask for. I mean, we are truly, truly grateful to you for your time. I know you've done 6 or 7 events today, and thank you for making time for us today in your busy schedule. Once again, ever grateful to you for your time and space. Thank you. Namaskar. Thank you. Now, I'd like to invite Dr. Sumitra Subhash for the felicitation speech. Dr. Sumitra Subhash is an adjunct faculty in Amity University, Dubai. She has a doctorate in microbiology from the Université Blaise Pascal, France. She has over 23 research publications, which includes research paper in international journals, poster presentation, conferences, book chapters, and reviews in the field of microbiology. She has worked in the field of enzymes in the international companies in France and Mumbai. She devotes her time in various social activities along with other science-related activities. In the fields of science, her contribution is evident through her publications and research papers. She was also the recipient of several scholarships and grants, which include French Embassy, DBT Government of India, University Blaise Pascal Fellowship, etc. She's also the Middle East Joint Coordinator for Samskrita Bharati. Samskrita Bharati was founded in 1981. It's a movement for continuing protection, development, and propagation of Sanskritam language, as well as literature, tradition, and the knowledge of systems embedded in it. Samskrita Bharati is a non-profit organization comprised of a large team of very dedicated and enthusiastic volunteers who take the knowledge of Sanskritam to all sections of society in spite of race, gender, religion, caste, and age. I would really wish to invite Doctor to share her insights with us. Dr. Sumitra Subhash, welcome. Namaste.
Namaste. Shubha Sandhya. Thank you, Dr. Smita Prabhakar. It's an honor to be a part of this online International Day of Yoga Celebrations 2021. What a wonderful concept and theme. Very well executed, where we have subject experts, yoga gurus explaining the essence of yoga, performing yoga, bringing positive changes in our lives. Prana, that breath, that energy which brings life to all. On behalf of Samskrita Bharati, I congratulate Team Prana and its organizers for creating this amazing journey spreading across 14 days. Just not 14 days, but the essence that shall last long, or like we can feel throughout our entire life. Here we had family yoga, children performing, we had experts from different arena of subjects sharing their wisdom, talking on spreading love, passion, peace, parenting techniques, and today on how to handle depression by practicing yoga. We also had several guest speakers enlightening us with their wide experience on various topics, that too from different parts of the world, what we call as Vasudhaiva Kutumbakam. World is one family united in the name of yoga to stand for a cause, to bring that energy, prana in our lives. In the current pandemic situation, it was indeed an informative, timely, scientific speech based on research studies which we had from Dr. Raghavendra Rao from Ministry of Ayush to fight against the depression caused by COVID-19. How to prevent and manage depression by practicing yoga. Thank you so much, sir. What a wonderful thought, well presented by Dr. Lijo Francis. Thank you, sir, on the insights on how yoga could bring several positive changes in one's life. And we do have a pleasant host who takes this journey so peacefully with full of energy. Great job, Dr. Smita Prabhakar. Well,
Thank you.
As we all know, the language of Yoga Sutram is Samskrita. Let's all learn, understand, and do yoga from the original text of Patanjali Maharshi. Samskrita Bharati as online classes specifically for teaching Yoga Sutram. Yogena chittasya padena vacham malam sharirasya cha vaidakena yopa karotam pravaram munina patanjalim pranjaliranatosmi. Let's practice yoga every day. Let us be happy within always and celebrate happiness. Sarvepi sukhina sant. Dhanyavada.
Thank you so much, Dr. Sumitra Subhash. Beautifully said. Vasudeva Kudumbakam. What a way to end this beautiful evening. And thank you for your time and your kind words. Now, let's announce the next day's event. We will connect again tomorrow live with an incredible Guru Miss Mai Avadha from Bahrain. Tomorrow, we will be discovering 3 hours relax, refresh, rejuvenate. Yoga teaches how to listen to the self, to yourself. And our chief guest for tomorrow is Dr. Ghazi Al Madani, Executive Officer, Dubai Sports Council, Asia's Deputy Chair of Finance Committee at Badminton Asia Dubai Sports Council and University of Dubai. We are really looking forward for tomorrow. Just a reminder, please remember to send your videos for the Yoga Challenge. The Yoga Challenge started yesterday, and we will be receiving the videos on June 20th. Let's spread the yoga wide for peace. Thank you. Namaste. See you all tomorrow, same time, same live, 7:30 p.m. UAE. Now let's conclude the evening with a prayer. Namaste.
Namaste. Om Sarve Bhavantu Suginaha Sarve Santu Niramayaha Sarve Bhadrani Pachindu Ma Kaschid Dukkha Bhagavate. Om Shanti Shanti Shanti. Let all be happy. Let all be healthy. Let all see the good in others. Let no one suffer from unhappiness. Om, peace. Namaste.